There are several types of diabetes, and the first type of diabetes is called diabetes type 1, and this is like an autoimmune diabetes where the typical patient is very young and very thin and underweight, and they have auto antibodies that destroy the cells of the pancreas called the beta cells, which produces the insulin. And the insulin is the chemical that lowers the blood sugar. So they have an reduced production of insulin in this diabetes type. And the other type is called diabetes type 2. And in this type, there is a mismatch between the production of insulin and uh, how much insulin the body needs. And so there is insulin resistance, because even so the body can make more insulin, because the blood sugar is so high and it needs to go down. Even so, the body is resistant to the insulin, so it has a reduced effect, which causes the blood sugar to remain high. And there are several risk factors which can increase the likelihood of this disease, and it is, for example, being overweight and drinking alcohol, smoking, sitting still for long periods of time, like working in the office, and generally living an unhealthy lifestyle, which makes this a very common disease. And these aren't only two types of diabetes. There is another type, which is called LADA, and this is the most common of the subtypes of diabetes, other than type 1 and 2, and it stands for latent autoimmune diabetes in adults. And it's called this because the diabetes typically occurs at a late onset of age, where the typical patient is over 30 years old. And some people call this diabetes type 1.5 because it shares common traits with type 1 and type 2. And a simple way to put it is that it's basically a diabetes type 1, but the onset is much later. And so another type of diabetes is called MODY. And it's called this because it stands for mature onset diabetes of the young. And this is diabetes that occurs at a young age. So it's basically the opposite of LADA, to put it roughly, but the typical patient is under 25 years old. And this is a monogenic disease, which means that there is one gene the patient has, and it has a mutation. And when that mutation occurs, it leads to the development of this disease. And so the fifth type I'm gonna mention here, there are a lot of other types of diabetes, but these are like the main ones. It's called like gestational diabetes. Gestational diabetes. And this is like diabetes that occurs because of pregnancy. Because when you're pregnant, you have normally an increased blood sugar level to a certain degree, but like for some people, it can be very elevated. And this is because in pregnancy you normally have insulin resistance, which causes your blood sugar to rise. But if this mechanism is to a much bigger degree, and the blood sugar can become too high even when your pregnancy is finished. And the cause of this insulin resistance in this diabetes is it's not fully understood yet, but probably it's to like give to ensure the baby gets its blood sugar. And the way this is tested for, they do like a glucose test where the mom drinks a drink containing a lot of glucose, and then they wait 2 hours, and then they take a blood draw and they look at blood glucose level again. And if this blood glucose level is over a certain level, often it's 11.1 millimoles per liters, then you have gestational diabetes. So now I'm trying to stop it.